Right, that's it for the headlines. Let's now shift our focus to this matter, where more than 50 interns and community service doctors in Gauteng are still waiting to receive their salaries for January. The South African Medical Association trade union immediately contacted the Gauteng Department of Health after receiving numerous complaints from their members. To give us an update on the story, we're joined by the organization's vice chairperson, Dr. Mvuyisi Mzukwa. A very good morning to you. Thank you for joining us this morning. A really concerning matter is that they're still waiting for their salaries, and it really is a difficult time for the health workers and doctors and nurses in the country. One can almost imagine the sort of impact this has on those who are working and risking their lives on a day-to-day basis.
Good morning, Mpo, and good morning to your viewers. Thanks for having me in the show. I just want to make a small correction. I'm speaking on behalf of the South African Medical Association, not necessarily the trade union aspect. The association and the trade union are separate entities. But coming to your question, I think to us it's a huge disappointment. At the time when healthcare professionals needs all the support they need to attend to the pandemic, including their social life, their psychological needs, and knowing that these interns are coming from the university, fresh from the university, so you'd expect the department to be very sensitive. It's not only the Gauteng Department of Health. There are so many provinces, almost all provinces involved, where interns are placed. And to us, it's an insult. It's a disappointment to have healthcare workers not receiving their salaries. Remember, we've been always telling this department and this government that it is an insult to be telling healthcare workers that they are heroes, and you don't pay your heroes. You just pay lip service, in you trying to encourage them. This is a serious indictment on the part of the Department of Health, to have healthcare workers going hungry to work and having nothing to fall upon.
Now, you have since raised this matter with the Gauteng Health Department, of course, just knowing that it's 48 interns and 14 community service doctors who have been affected by this. What response did you get from the department? And I'm really keen to find out what the reasons are that this matter was not resolved.
First of all, Mpo, this is not a new problem. As you know, this is now becoming a norm in South Africa, not only in Gauteng, where you get interns not getting their salaries. I mean, in the Eastern Cape, as far as 2006, it has been an established trend that interns are not going to get paid on the 1st of February or end of January. So it is a serious challenge that the healthcare workers are always facing. The excuses are that there were shortages of documents, but you'll get an email that confirms that the document has been submitted. There are very petty kind of excuses that we're getting from the department. And what we have done on our side is that we wanted to talk to the people who should be taking responsibility, like your head of department in all these provinces, to understand why is it a norm for a doctor not to be paid when they've actually done their work. Some of these interns have not even been paid their overtime. You expect these interns to be having this high morale at work and be seen to be performing and to make no mistakes at work, when actually they are out in terms of their psychology and in terms of being hungry and unstable at work. So those are the challenges that really must be taken seriously. And I don't think this issue is getting the attention that is supposed to be getting. Because you must remember, if a doctor makes a mistakes in a hospital, that goes all over and it becomes a news headline. But this one is getting dribs and drabs when actually this is a sabotage to the programs of the Department of Health.
Now, you keep mentioning that this is not a new issue. It's happened before, and you speak to the ripple effects of the impact of salary delays and the morale of healthcare workers. And we know that we're really in an unprecedented time where morale and staff shortages have been exacerbated by the impact of COVID-19. When it comes to ensuring that this matter is resolved and it doesn't happen again, and it is indeed highlighted and gets the attention it deserves, what are the grassroots levels here? Where do you think the solution will come from, especially looking at the kind of leadership that is within the Gauteng health system?
Yes, Paul, you are right there, because I mean, in the Eastern Cape, for example, and and also Gauteng, we've been complaining about, these people who are always in the acting capacity in these leadership positions. And on top of that, you find that these are political appointees who have no necessary competencies to be running something like a hospital and attending to the challenges of the institutions. Somebody once said a few years back that running an institution like a hospital is more than it cannot even be compared to running an airport. So you can imagine how complex the issues are in the hospitals when you just get a simple, ordinary political appointee to be running an institution. So those are the issues where there's high levels of incompetence, where there's no leadership, or else people are in their acting capacity. They really don't have what it takes, to run an institution so crucial like a hospital, that should be attending to the health needs of communities and making sure that we do not get the setbacks that we see coming up in the media now and again, where people are not attended to accordingly.
And how are you planning to then hold the department accountable? I mean, you raise an important aspect here about what will make headlines should a doctor make a mistake, but this matter is one that is not highlighted by the media. How are you ensuring accountability?
The only thing that we can do now is to drag the Department of Health to court, because this is not acceptable. They are going against the Labor Relations Act or conditions of employment. They are breaking every rule in the country. So we do need to drag them to the courts of law so that they understand how serious this matter is. We are simply following the necessary steps that we must follow, to address the problem. But ultimately, the issue is that we must force them, drag them to the court of law, because you cannot have government officials who are acting with impunity. They do as they wish, and there's nothing. There are no consequences. But when it comes to healthcare workers, they are expected to function at their maximum. That cannot be. I mean, we have to be hard on them, no matter what happens.
You speak about morale, and we know that we've heard a lot about the impact of COVID-19 within the hospitals and how it's affecting healthcare workers in terms of, how they're feeling about coming to work, really essentially putting their lives on the line. Give us a sense of how this salary issue, coupled with the low morale and the stress of being in a hospital, is affecting healthcare workers.
Thank you so much, Mpo. Remember, Mpo, there are so many things that are affecting healthcare workers. One is the issue of not getting psychological support in the institutions. there is no debriefing, whatever happens, no matter there's a big event that happened in the hospital, there is no debriefing of the healthcare workers. Now, if you have healthcare workers not being paid, remember they're not even getting their raise. They are only praised as these heroes. You know, everybody calls healthcare workers heroes. And it's a mockery, especially if it comes from government officials, and even the minister himself. It's a mockery to be saying these are heroes. We are not heroes. We are just what I call sacrificial lambs that have been left, to die on their own. So this, you can imagine the anger that is there. That there's no support. But on top of that, we have these people who have no directions at all in terms of leadership. Healthcare workers are made at times to attend to administrative tasks, especially at night when there are no managers, when there are no beds at hospital. You want to admit a patient and there are no beds in that institution. A healthcare worker, a doctor, is expected to call all the surrounding institutions looking for a bed. That is an administrative task. But if you have those issues not being addressed, and on top of that, you are not getting paid, I mean, you can actually imagine what is going to happen with you. There are so many of these things not being paid, not being acknowledged, shortages of staff. Even if you are ill, you've got to pull yourself to work. So those are the issues that are affecting healthcare workers, and it's like to government is business as usual. There are no changes. There are broken instruments in the hospitals. The resources are not there. Whatever people can say and try and save their face, but when it comes to healthcare workers, we know exactly what is happening on the ground. Our healthcare workers are being abused. When this is a psychological abuse. When you cannot pay a healthcare worker who have done his work, and there are no complaints from your side that this healthcare worker has not performed, but you just simply not pay that healthcare worker. You can imagine this person is coming from a family where they are expecting this person to make payments to support the family. It's got loans, university loans that needs a repayment, and you don't pay that healthcare worker. You can imagine what is happening in the psyche of that person, on top of the incompetence of the leadership that is there in the institutions.
Very well. Thank you so much for your time, Dr. Mvuyisi Mzukwa, and of course putting those concerns to the public as Vice Chairperson of the South African Medical Association. Gives us a sense of the impact of some of the challenges facing healthcare workers across all provinces.